I think another unique test we've spoken about before is microbiome testing, so both vaginal and semen microbiome testing. Are you able to kind of elaborate or kind of talk about that a bit more?
So I think this is such a fascinating area of research at the moment, and you know, it's worth saying that it's relatively novel in terms of an area of research versus the gut microbiome, but still the early results are alarming and incredibly useful. So we can run both of those tests, and we've got some amazing research findings already. So for example, 30% of infertile women have an imbalance in their vaginal microbiome. There was a study done by Tommy's The Miscarriage Charity that found that in pregnancies which were chromosomally normal, the other women had an imbalance in their vaginal microbiome as well. So it's an important area to try and optimize for implantation rates, for IVF success outcomes. We've got all the research on this, for reducing miscarriage rates. But also, if you think about if you're having a natural birth and you're having a birth through the vaginal tract, the baby's going to be coated in the vaginal microbiome on the way out. So you really want to make sure it's looking good, because otherwise it could be affecting the baby's immune system. And there are even strains like group B strep, for example, which we know can cause some pretty harmful have some pretty harmful effects in the baby. So if you can catch that early, then that's great. And we like to work preventatively, you know, so let's do these tests up front, see what could be contributing towards your issues, or could be, if you're at the start of your journey, could be preventing you from getting the outcome you want, and try and optimize that first. And again, I'm glad you mentioned the semen microbiome, because let's face it, if someone's having sex, they're going to be swapping their intimate microbiome with the other partner. So if there is, for example, ureaplasma in the vaginal microbiome, we definitely need to test the man as well, because the likelihood is they're passing it between each other. If you get rid of hers, he's just going to give it back to her again. So yeah, we've got to look at both partners.